Breastfeeding reminds us of the universal truth of abundance. The more we give out, the more we are filled up. And that divine nourishment, the source from which we all draws, is like a mother's breast, ever full and ever following. The theme of the World Breastfeeding Week 2020 is Support Breastfeeding for a Healthier Planet. Today, we are going to say about the techniques of breastfeeding. Breastfeeding is the best natural feeding and breast milk is the best milk. Breast milk basically composed of colostrum, transitional milk, matured milk, preterm milk, foam milk and hind milk. Breastfeeding technique is the composite of positioning, attachment and suckling. Positioning refers to the technique in which the infant is held in relation to the mother's body, and attachment refers to whether the infant has enough areola and breast tissue in the mouth. Proper positioning of the mother, good attachment of the baby to the breast, and effective breastfeeding technique. It is important to establish good relationship between both mother and child and to ensure milk transfer and to prevent breastfeeding problems. Ineffective breastfeeding technique result in insufficient intake of breast milk, which cause poor weight gain, poor positioning, attachment and suckling, which leads to sharp reduction of exclusive breastfeeding practice and increased breastfeeding problems.
Preparation for breastfeeding. Preparation for breastfeeding must begin in the antenatal period itself. In this period, examination of breast and identification of problems like retracted nipple should be done with necessary advice for interventions. These help in motivation of the mother and successful establishment of oxytocin reflex at the time of breastfeeding. Now come to the techniques of breastfeeding. Mother-led attachment. The more traditional technique of mother-led attachment works for many mothers and babies. There are some basic steps for this technique. Sit upright and support yourself well with pillow. If your breasts are small, you might need a pillow on your lap to bring your baby to the right level. Hold your baby behind her back and shoulders, so her chest is touching your chest. Bring her nose in line with your nipple. Gently brush your nipple from your baby's nose to his lips. This will encourage him to open his mouth wide. When your baby's mouth is wide open, quickly bring your baby to your breast. Directly your nipple at the roof of her mouth. Her mouth will close over your breast and she will start sucking. When your baby is just below your nipple, he will dig his chin into your breast. Reach up with an open mouth attached to the breast and start sucking. In case of cesarean section, if you have had a cesarean section, Gently encourage your baby to move her legs and body to one side of you so she doesn't kick or lie on your wound. Use a pillow next to you to support her legs and feet. You can provide support behind your baby's shoulders and bring him bottom in closer to your body if you need to. Mothers should be comfortable and relaxed physically and mentally before giving breastfeeding. She should wash her hands and can have a glass of water or milk before giving breastfeed. Mothers should have no dew work in her hands. Baby should be cleaned and dried before feeding. Otherwise, baby may feel uncomfortable or may non-cooperative during feeding. Correct positioning of mother and baby is an important aspect of successful breastfeeding. Mother can be in flat with infant on top of the mother, especially following lower uterine cesarean section delivery. Baby should be supported by the mother's forearm inside head elevated position and with head, neck and back in a straight line. Baby should be folded close to mother with trunk to trunk in touch and facing towards
Now comes to the position of breastfeeding. There are various positions of breastfeeding. First position is side lying whole position. In this position, lying down with your bodies parallel. The next position is cradle hold position. In this position, holding your baby across your lap, supporting her with the same arm as your breast. The next position is cross cradle hold position. In this position, holding your baby across your lap, using the opposite arm to the breast. The next is Rabi hold position. In this position, holding your baby underarm. Mother sit with the baby resting along her forearm. The next position is upright breastfeeding or koala hold position. In the upright or koala hold, your baby sits straddling your thigh or on your hip with his spine and head upright as he feeds, supporting your baby while she has straddled across your knees in the upright position. The next position is double Ravi bell hold position. In this position, using a cushion or pillow under your babies as you gently support them with your hands on their upper backs. The next position is laid back breastfeeding or recline position. The laid back breastfeeding position is also known as biological neutering. In this position, your baby lying across your stomach or shoulder. The last position is laid back breastfeeding after cesarean section. If you have had a cesarean delivery and can't find a comfortable breastfeeding position, they may help.
Now moving towards the latching. Latching means proper attachment. The baby's mouth should be properly attached to the breast for effective supplying of milk. It is important because poor latching may result in sore or painful nipple or poor milk supply to the baby. There are 4 signs of good attachment. They are: baby's mouth is wide open. Second one, the lower lip is turned outwards. Third one is baby's chin touches mother's breast. Fourth one is majority of areola is inside baby's mouth and upper areola is more visible than the lower areola. After proper positioning, when baby's chin touches the breast and cheek touches the nipple, the baby will open the mouth in a routine reflex. Then the baby will widely open the mouth so that the nipple and most of the areola go into the baby's mouth. The suckling of breast stimulates the prolactin reflex or milk secretion. Then milk flows out from the glands into the lactiferous ducts and then to the baby's mouth by the oxytocin reflex or milk ejection. When babies suckle again and again in regular slow deep sucks with good sucking reflex, the adequate milk flows out. The mother may hear the swallowing sound and does not feel pain in the nipple. All these indicate favorable signs of good attachment or latching and breastfeeding.
This is all about the preparation, technique and position of breastfeeding. So, we must encourage every mother to breastfeed their child for at least 6 months exclusively. Thank you for watching.